I'm not sure who to address these questions to. As I went through this, and I agree with the premise, we know that emergency rooms carry a terrible burden and our resources are short. But when I looked, the ad hoc subcommittee, did it have any meeting agendas or minutes or any notes to share with anybody on what you discussed and how you discussed it? And let me put it into criteria so that when you answer it, acute care hospitals are not located in the unincorporated. However, we have community health centers that do acute care, and in the language we exclude them. I'd like to see why we would exclude them and why we wouldn't include them, and perhaps you could address how these recommendations were developed, because I didn't see any minutes or agendas or lists of people who you spoke with, or how you developed these recommendations.
Let me just answer the question about acute care, in that based on these recommendations, I think if I understand what you're getting at around that is that you want to make sure that members of the incorporated communities are receiving every level of care that they can, and that no one is left out of this process as we explore how to expand our CMS services. And CMS services, from my understanding, covers the very population that you're talking about. And so I think so for that concern is what I'm hearing, that this recommendation is certainly all encompassing. So the second thing I'll say, and I think the chair can comment on this more, but this conversation, we really were steeped in a consultant that we had come and present to us that we're trying to get to this board meeting. But based on her schedule, we want to have her come and present to the entire board, because she is has decades-long experience in arenas at every level of government. And so we are still working on that and getting her before the full board, but still think that we can do those in conjunction with doing the additional background work that we need to do before we take any real action on any reforms. And so that is something that we requested of her, and that really was the crux of the conversation around CMS within that subcommittee meeting. So that's coming forward, moving forward, and my hope is that it's sooner than later.
Yeah, let me just add to that. I agree. We both really wanted to have J.C. Cooper here today, who is really the driver, the consultant that the county has hired to sort of help us analyze, what are the impacts that we're looking at on our healthcare system. And she did like a really in-depth presentation about our vulnerabilities, and that was this kind of the call to action for us to move this in an urgent way. She wasn't able to be here today. She has a meeting, but I did ask her if she could come as soon as possible. So she's looking at hopefully being able to come to our next board meeting. And I would love to just kind of put out there that I do think this is a conversation that our whole board should be involved in. It's really important. And this is sort of like a question to my colleagues. If she's not able to make it to our next board meeting, would folks be interested in having some kind of special session to kind of hear her analysis and how what she's seeing on our community? Because it's been a scheduling issue. So, okay, I'm getting a yes from Supervisor Anderson. Okay, that's great to hear. I've been reluctant to try to schedule a special session because I wasn't sure if folks would be able to attend, but if that's something people are interested in, would definitely love to do that and kind of bring everyone into this conversation as we go along. So I think that's really important. And to answer your question, I think one of the things, and again, we'll get more of this when she's able to come, but I think to your concern, Supervisor Anderson, about the folks in the rural part of San Diego County, The data that we saw from J.C. Cooper is that you're right, that actually the people in your district are going to be like very severely impacted. And so we anticipate that this work will pretty significantly address exactly that population. And to be honest, folks in your district, in Supervisor Montgomery Stepp's district and Supervisor Aguirre's district are sort of really front and center. Just to add on to Supervisor Aguirre, coming out of the conversations, I think there's been a concern raised about the vulnerability of the hospital system, specifically in your district, and the potential for a hospital to potentially have to close if we don't do something pretty dramatic to kind of backstop what's happening. So again, this is like a countywide issue. Your district's pretty significantly impacted. This is Supervisor Aguirre's and Vice Chair Montgomery Stepp. And it would be great to have a broader conversation. We didn't want to wait. I think the kind of urgency was we need to get moving because it's going to take quite a while to like have these consultations and have these conversations to try to figure out what we can do about changing the way that we operate with CMS. But my preference, I would say, would have had to have J.C. Cooper here today, but we didn't want to wait on this like really time-sensitive item for her to be able to come. So I think my commitment to you would be if you all can make yourselves available for a session, hopefully we can either get here at the next meeting, and we can have this kind of robust conversation. And if not, I would love to schedule a special session with her.
In a follow-up, so I didn't know you were working with J.C. Cooper. Otherwise, I would have Googled to find out more about, is it an individual or a company?
It's a person. You should Google her, actually.
No,
she's
happy
amazing.
to. So, but
yeah.
What did you solicit any kind of community input in this process? Without minutes, without agendas, there's no way to see the work that's being done. And I would make may I finish, please?
Let me just say.
Wait, hold on, Vice Chair.
I think I have the mic.
Vice Chair, thank you.
So one of the things that you might want to consider moving forward is when we had our subcommittee meeting, we did it in this room, we recorded it, it's on the county website. Anybody can see it, anybody can go back. We didn't take public comment because it wasn't a full board meeting. However, the public could always email us, call us, send letters to us. A lot of the recommendations of the people we spoke to came from the public. And then, of course, the public had that, and you had this process. Nowhere in the work that you've done, I can go back and feel reassured that the 550,000 people that live in the unincorporated are being covered. And when I read this, and look, I agree with where you're going. I'm not against what you're doing. I just want to make sure that when we're working with these vulnerable populations, that we're really thoughtful and we get it right the first time. But when I looked at this, we're only talking about hospitals, and part of the problem of the unincorporated is if you live in Potrero and your average household income is $42,000 and you have an issue and you're not addressing the clinic that's near them, they're going to be an emergency room call coming into the city in an ambulance. And so the people that need it most should be at the forefront. And if we're using J.C. Cooper, who may be city driven and never been to Potrero and doesn't understand the demographics other than on paper, we've excluded people like neighborhood health care or San Ysidro health care. Some of these groups that service these areas should have been a seat at the table.
Well, I think it would be, sorry, I'll let my colleague go.
Well,
I just think it would be important to clarify that we're, okay.
Madam Chair, I'm almost finished. Last year, our county medical services provided services for approximately 40 medically indigent people for over $970,000. And only 2 individuals were enrolled at any given time. I think part of our issue is also looking at what are we doing and how effective we are at it. When you think in terms of almost $1 million being spent and there's only 2 people in it at any given time, I think that this is a much bigger, broader issue. That's why I welcome your invitation to hear it, because I have a lot of questions. And if you had published on the web or had a meeting here, I could actually see the public input, and many of those questions would be answered. And I wouldn't need a special meeting because they would have been addressed, because I could do the research on my own by simply making sure that you asked the correct questions. I'm sure you asked incredibly intelligent questions, but we all have different districts. We have different constituents, and I just want to make sure that we're reaching every district to the full extent. So
Okay.
with that, I'm eager to hear what you both have to say.
No, I just think there might be a fundamental misunderstanding of what this board letter is. You're talking about a table on which we've gotten input. This board letter is to create the table. We are directing the CAO to start convening and have those consultations, because we do need to have those broad consultations. We haven't at all done the work to figure out, like, what are the reforms we need to CMS. This is to get the work moving and the ball rolling. So I thought it was written pretty clearly that this is to direct the CAO to begin those consultations. To say it again, it's to direct the CAO to, but totally agree. We have to talk to the whole community in a really broad way. That is the work that needs to start. And instead of us as a subcommittee, like, going off and doing it on our own, we actually came to the board and said, hey, we actually think this is something that the whole board should know about. There should be transparency around it. We're not going to just go, me and Monica, like, cook a whole cake on how we're going to revise our entire medical system in San Diego County. That's why we're here with this board letter, to say, hey, it came to our attention through the sort of initial tire kicking of our subcommittee that putting together that table and that consultative process to really rethink the way CMS works is like a really critical thing that we have to do. Instead of us just going and doing it, let's bring it to the board. Let's make sure we have a board endorsed process that the CAO can direct in a way that's transparent. So again, I think, like I said, I think there might be a misunderstanding on, like, what this board letter is. Like, that is what the board letter is, to begin that consultative process, because we didn't feel that it was appropriate as a subcommittee to kind of do all that work without coming back to the board and making sure everyone knew what the kind of the crisis we're in, so we could then get, like, broad board direction for the CAO to engage in this work. So I don't know if the vice chair has anything to answer.
Just want to say I continue to look forward to the board's input, which is why the letter is here. And if there's anything that's lacking, we are legislators, and it's kind of what we do on a dais too. If there's something or someone that is not included currently in looking at the reforms and opening up that table and those conversations to ensure that everyone is represented, then I think that we can look at the board letter and maybe amend it if you're so inclined to support it. That's why it's here. So there's nothing being done in a subcommittee that would prohibit the 5 people here who are elected to represent all the 3.3 billion from doing their job here on the dais and then having that translate into the policy.
To finish up, in recommendation 3, you talk about acute care hospitals. That's exclusive. I mean, what you've done is you've narrowed what we're talking about to what you presented, and that excludes any of the acute care that's actually in the unincorporated. So I'm asking for a friendly amendment to change that from acute care hospitals to acute care community health centers too. So
Let me open the item just to look at it while you're giving me the amendment, so I can see exactly what you're proposing.
So that way, as staff is moving forward, you haven't ruled out stuff before we ever started. And see, the issue I have, I agree with everything you're saying, but it's our bias to rule things out because we're not thinking from all 5 districts. We're thinking from the districts that we most frequently are in, our own.
Can you
And so,
tell me again what your proposed amendment is?
So right now it says acute care hospitals. I'd like for it to say acute care community health centers. Many of the health centers in the unincorporated are acute care, but they're being excluded from the process. And I'm happily would be supportive of that. My problem is I don't know how we got to where we are, and maybe this would have been better described as just a joint authored board letter, not an ad hoc subcommittee result, because when you say ad hoc subcommittee, I'm thinking there's going to be agendas, meetings, community input, notes to share, in how, you know, and it's clearly laid out how you got to the recommendations, in who played a role in developing those recommendations. You have these recommendations. By the way, I totally agree, but I just want to make sure we're not making this so narrow that we've excluded the unincorporated before we even start. And since this is just a process where staff's going to come back, why would you care if it's narrowly defined
I
unless
am
you have a
fine with your
predicted outcome?
recommendation, but I just want to reiterate what you said, is that you said that we should have been less transparent about what happened in the subcommittee and not brought this forward as a subcommittee item when this is what we discussed in the subcommittee and we wanted to bring it to the board. So
But-
that for me, I'm fine with including clinics, FQHCs, to be a part of the conversation. I think they're already county contracted, but a part of the conversation. But that's why I think it's important to bring it to the board so that we can hear that feedback. It doesn't have to be an insult and accusations that folks are not being transparent. It'd just be an amendment, that's all.
Supervisor, I don't mean it to be that way. I'm sorry you took it that way. That's not my intention. But there's nothing here. And when I read this, you know, I just want to point out to y'all that you excluded the unincorporated in the verbiage. And I'm glad that, I knew if I brought it to your attention, you'd be open to it, because you're always very reasonable and you have a great approach towards this.
I would just say, one
there
of
are
your
no
recommendation that the clinics do not do acute care. So that's probably another reason why, but I'm okay with them being at the table for sure.
I mean, how about, I'm just kind of thinking about this. First of all, you're saying we excluded the rural areas. This is not true, but for your greater peace of mind, if you would like to make that abundantly clear, we can certainly add, you know, with primary emphasis on acute care hospitals, and ensuring cross-county in representation, including the rural parts of our county. I mean, if you feel so insecure that this is written in a way that's going to like exclude the rural areas, we can certainly say that, because that's obviously the intent. But if you need that for your own insurance, if you want to say something with, you know, we can add a clause that says primary acute care hospitals and ensuring countywide impact from all districts, including our rural communities. I'm fine to include that.
Madam Chair, you waived our board policy A72 in presenting this forward. That's our safety check. You have no minutes, you have no agenda, you have no notes. I'm sure that you're very thorough, because you are a thorough person and you did a great job, and I'm sure because everything you do is quality. But there is nothing for the public or for me to see on how you determine this. And then when I look and you've excluded acute care in the unincorporated, the hospitals do provide it, but some of the clinics do too. And you've left me no choice. If you had a more transparent process.
But Joel, sorry, Supervisor Anderson, I'm offering to accept an amendment. What amendment would you like to make?
May I please finish? If you had had hearings that the people you talk to, when they give testimony to your subcommittee, if it was public, if it was on the website, then I could go back and be reassured. I mean, I have no idea who you even spoke to other than J.C. Cooper. And
you don't even know who she is. So that's a little bit of an issue, but go ahead.
The reason why I don't know who she is we didn't learn who you spoke with, because there's no minutes, no agendas, no notes, nothing public.
Actually, that's not true. It is a public record, like extremely public, that we as a county approved a contract with J.C. Cooper to consult with our county on this entire process of how to transform our medical system. So maybe you weren't paying attention to that meeting, but that is not a secret.
Okay. I'm losing ground here. You've agreed to an amendment.
Well, now I don't know. I just offered you one, but now you're being rude. What would you like to do here? I would love to be able to have broad board support to support our provider system so it doesn't collapse. We both offered to hear an amendment, and you've just continued to insinuate that somehow myself and the vice chair have hid from you a contract that we have with J.C. Cooper that you all approved and are well aware of. If you're not well aware of, then your staff didn't brief you.
We approve a lot of contracts. I never heard anything that J.C. presented. All of the things that J.C. presented could have been posted on our website for public view, so we all know. And we're only contracted with one person, but who were the community input? Who represented everybody at the table? Were all the hospitals there? I think they are, because they're all here. But what about the clinics? What about the other folks? Look, I'm saying all I'm looking for is that we don't, in our recommendation, predetermine where we're headed when we're still in fact-finding mode. And I think you brought it to the board of 5 so that we could help participate in the final decision. So I'm asking that we don't make it exclusive, we make it inclusive and allow those clinics. I'm just going to pick 2 off the top of my head. Neighborhood healthcare, San Ysidro Healthcare, both participate heavily in the unincorporated. I'm sure there are additional people, but I don't have everybody memorized. And I know that there are more, but I just don't know them all off the top of my head.
Supervisor Anderson, I'm trying to get to an amendment. I offered you an
Chair,
amendment.
can I suggest something?
Could you repeat the amendment that you're offering?
Yeah, I'll give you 2 options, 2 choices. How's that? So you can choose. Option 1 is simple. Right now, it says, with primary emphasis on acute care hospitals. We could cross out the word hospitals and say providers. That is
Perfect.
inclusive. The other option would be